PTSD has some frontal findings, but ultimately PTSD has a rather substantial disturbance deep in the brain, in the amygdala. This is actually the right side amygdala fMRI, which it's like you're looking down at the patient's face and head, and it's reversed basically. So this is the right amygdala and insula that basically end up being involved in the PTSD. And this work was done actually fairly recently. This is Thomas Ross does end up specifically pointing to the subcortical locations that are involved in essentially emergency stopping. The right insula and amygdala, if you give somebody an event-related potential task, that's a go, no-go, stop task, where they actually have to start a response and then get a stop sign that they have to abort the action that they started. And the right amygdala and insula work with the operculum, the surface cortex overlying them on the right side. And that's your emergency braking system. That's the ability to stop. In PTSD, this particular circuitry ends up being in trouble, basically. The amygdala on the right side also perceives emotion and is involved in the perception of faces. When this test showed that spot, it was evoked by looking at different facial expressions as a stimuli. We have not just surface cortex with simple surface patterning. We also have deep brain disturbances in PTSD. When the amygdala is activated like that, and you're sitting there with your eyes open, you end up with lambda at the back of the head, which is a visual event-related potential. You have an exaggerated response to stimuli. When you're emotionally charged up and you get a stimuli, you have a jumpy, excessive response. And you've probably seen that. And yes, if you startle somebody who's actually got a fair amount of anxiety, they're off the floor 6 inches, as opposed to just somebody who turns around and says, "What the hell are you doing? Messing with me here?" The jumpy person has an emotional charge already, and people that suffer PTSD and really severe anxiety can end up having that kind of response.